How do complication risks differ between acute and chronic diverticulitis? Have you ever wondered how the risks of complications change between acute and chronic diverticulitis? Understanding the differences can help you recognize the seriousness of each condition. Diverticulitis occurs when small pouches in the colon will become inflamed or infected. Acute diverticulitis is characterized by a sudden onset of these symptoms. Patients often experience severe abdominal pain, particularly in the lower left abdomen, along with fever, nausea, and changes in bowel habits. The complications associated with acute diverticulitis can be quite serious. They may include abscess formation, where pus collects in a localized area, perforation of the colon, which can lead to peritonitis, a severe inflammation of the abdominal lining. There's also the risk of sepsis, a systemic infection that can be life-threatening, and bowel obstruction. Due to these risks, acute diverticulitis often requires urgent medical attention. This may involve hospitalization, intravenous antibiotics, and bowel rest. In severe cases, surgical intervention might be necessary to manage complications like perforation or to drain an abscess. On the other hand, chronic diverticulitis involves repeated or persistent episodes of inflammation over time. This condition can lead to ongoing symptoms such as intermittent abdominal pain, bloating, and altered bowel habits. The risks associated with chronic diverticulitis are generally linked to the cumulative damage caused by repeated inflammation. Complications may include strictures, which are narrowings of the colon due to scar tissue, fistulas that create abnormal connections between the colon and other organs, and chronic abscesses. Chronic inflammation can also increase the risk of bowel obstruction, but this is mainly due to scarring rather than acute inflammation. In summary, acute diverticulitis poses a higher immediate risk of severe infectious complications that can be life-threatening and requiring urgent treatment. Chronic diverticulitis, however, carries risks related to long-term structural changes in the colon, which may cause ongoing symptoms and requiring different management strategies. Both forms can lead to bowel obstruction, but the causes differ. Acute diverticulitis is due to inflammation and swelling, while chronic diverticulitis is due to scarring and fibrosis. If you or someone you know is experiencing symptoms suggestive of diverticulitis, it is crucial to seek professional medical evaluation. This will help determine the appropriate care and management strategies. Lifestyle and dietary changes may help reduce the risk of recurrence, but these should always be guided by healthcare providers based on individual needs.